everyone. Good morning. It's wonderful to see all of you. Shall we begin? Let us join you in sitting down. I was just mentioning to Keith and to our distinguished guest here that this morning we had a program with President Obama and President Biden about the Affordable Care Act, that today is the 14th anniversary of it being signed into law.
Yeah,
2 days ago, we had Gavel Day, the 21st, when it was gavelled down and passed the House and then sent to the President, but 2 days, then today it was signed. And they were very excited. It was amazing because they were so enthusiastic about what we had done, how it has been improved, and how much more we want to do. Very exciting then and here was the thank you that this was about. Because with all of our maneuvering and intellectual resources and our committee chairs, everybody knew that we could not have ever passed it or we could never have saved it without the outside mobilization. Inside maneuvering just takes us so far. But the outside mobilization, people weighing in, patient groups, families, organizations, the nuns to save us from the bishops. So in any event, this is part of that was more on the political side with the presidents because they wanted to make the case of how important this next election is. So we won't go there here, but to say how wonderful it is to be back again, the Southeast Family Health Center. Grateful to have Dr. Grant Colfax here, the Director of the Department of Public Health. Thank you for joining us, but let us salute the Dr. Colfax for his leadership in fighting COVID and I know we're not calling it monkey anymore, but Mpox. Thank you so much for your great leadership. San Francisco led the way. And Keith, thank you, Dr. Seidel, for your hospitality here. I can't wait to get our tour again. I've been here before, be up to date today with it. This is just the title, Southeast Family Health Center. And speaking of family, I understand you have 2 of your children here today.
They'll be here in a sec, yes.
They're 8 years old,
They're 8,
so they may not
stick
stick with the program the whole time. Thank you, Keith, so much. Thank you. What was really important in all of this was the implementation, and Isabella Koo of Covered California is with us. She's a dedicated advocate. Covered California was a big success story, not just in our state, but a model for the country. And Peter Lee, who was the original leader of it, set just a wonderful example for the rest of the country. And Isabella has carried it, making her own mark. Thank you for being with us today. With her is Monica Soni, Chief Medical Officer of Covered California, and you'll just tell us how it is. That's where the rubber meets the road, but thank you for your service and honoring us with your presence today, Dr. Monica Soni. And what this is all about, a patient here at Southeast Family Health Center, Dr. Donald Johnston. Donald, thank you for sharing the generosity of spirit to share your story with us today.
It's a pleasure meeting you again.
Thank you. Thank you. But really, thank all of you, because as I look around this room, I see so much activism. I see so much an intellectual resource on all of this. And what's really important is for us to listen to you. And as we said with the 2 presidents, thank you. Thank you for being the intellectual resource. Thank you for bringing your experience of what has worked, what works better, what we need to do, and the rest. And that's what has been the success of it. I told them on this thing this morning that, and this isn't political, so civics. No, but it isn't, when you'll hear, that when there was an assault on the first of all, we were up against big money. We were up against big insurance, big pharma, big anti-government act, that kind of thing. And so we had a fight on our hands, but without going too much into detail there, unless you ask. Then there was the assault on it by the other person who came into the office, and he almost repealed Affordable Care. But why he didn't was because of all of you. As I said on the thing this morning twice, we had 10,000 events across the country. There were 10,000 events where people came and told their stories. Keith, they didn't do provisions of the law. They just told their stories. And there was nothing more eloquent, Monica, than that they would share their stories and what it meant to them. Just the other day, I went to honor, not just an example, I went to honor Rosalind Carter, some mental health organization and home care initiative folks were honoring her. And when I went in, her grandson came up to me and he said, "I want to thank you for saving my son's life." That's the first thing he said. I said, "Well, how old is your son?" He said, "He's 5 years old, but without the Affordable Care Act, he would not be here." But multiply that by 10,000 events where hundreds and hundreds of people came and then made their calls to the Congress, pounding away, and to the press and to the public, because people have to know. People have to know. And one of the things people have to know, young people have to know, that if what's-his-name were to become president, this is just civics, they would no longer be on their parents' program. They would no longer be able to choose to continue their education or be entrepreneurial, start a business, or go into an internship that may not pay, have health care, but is a path to their success in the field that they are involved in. And I don't think young people know that enough, so that's one thing we want them to know. But again, when those 10,000 events took place, people came back and said, "We think it should be said this way." This is the language that works when we make our calls. This is how people understand this, not in terms of bureaucraties or Washington speak, but in terms of the kitchen table, America's families. So we have important work to do. You know, over 100 million families have a pre-existing medical condition, which we want. That was the big victory in this bill, and they want to undo that. They'll say, "Oh, we'll give you pre-existing condition coverage," but the cost will be so high that they might as well not. No longer being a woman is a pre-existing medical condition. That's good, huh? Tens of millions of people have health care who didn't have it before. Lifetime limits. They used to have lifetime or even annual limits on what could happen, especially with little children born with a condition or something. They have millions of dollars in bills. Well, no more. Again, and young people can continue on their parents' condition. We've talked about what can happen if this were undone. So not only do they want to undo it, but they want to undo what is in the IRA, the Inflation Reduction Act. Mm-hmm. They want to undo the $35 insulin fee. It'd be $500, at the lowest, $400, $500, $600 a month for seniors on Medicare to pay for insulin. Now, because of that bill, it's $35.
Yeah.
They want to take us to court to reverse that. Pharma and their friends in the Congress and what's his name. The list goes on and on about limiting the cost of prescription drugs. It's in the bill that they want to change. But in their budget, they want to also eliminate many things that have to do with Social Security and Medicare, but no use to go into that. Today we're celebrating 14 years of not only passing it, not only saving it, but under President Biden, improving it with this different impact of the subsidies on other things. And one big thing that we still have to try to do, and maybe that happens in an election, is to have expanded Medicare throughout our country, because that takes us much closer to where we need to be in all this. So thank you for being here. You make the celebration a real celebration, because it's your celebration too. Right, Christine? Christine is always, right, Susan Pfeiffer, who's always on the phones organizing. I see Dan Bernal. We're so proud of Dan Bernal, the work he did during all of this. Thank you. But with that, I would like to yield to Grant and to Dr. Colfax again, in appreciation for all that you have done in so many ways for the health and well-being of people of San Francisco, again, as a model to the country. Thank you for honoring us with your presence as we celebrate 14 years of the Affordable Care Act.
Thank you. Well, thank you, Speaker Emerita. It's such an honor to have you here at the clinic today, one of our 14 primary care clinics across our Department of Public Health, which, as you know, also includes Zuckerberg San Francisco General and Laguna Honda Hospital, a big healthcare ecosystem. And yeah, as an administrator, but I think more importantly, even as a clinician, I see the benefits of the Affordable Care Act every day. Patients, stories that patients tell me, to looking at our budget. So from the security that people have, knowing that they can get health care, affordable health care for themselves and their families, that they can see a clinician when they need to, that they can get those vaccinations. I mean, can you imagine if we didn't have the Affordable Care Act, where we would have been with COVID and Mpox? It's unbelievable. So I want to thank you on behalf of the Health Department and on behalf of improving health and wellness for San Franciscans for everything that the Affordable Care Act continues to do. Just a few numbers, because you know I like numbers.
Yeah.
The Affordable Care Act, because of the Affordable Care Act, over 100,000 San Franciscans are newly covered in care. That is amazing. And in our system of care, that is especially because of expansion of Medicaid. Amazing. And right now in San Francisco, 97% of San Francisco residents have a form of coverage. Amazing. And when we talk about health equity and improving people's lives, I think the other piece I just wanted to put in here because of it's important is the Affordable Care Act was such a huge factor in making people healthy and well because they're not worried about getting into medical debt. Medical debt is a huge issue for patients. And Doctor, we were just talking about earlier how people would not come into care because they were afraid of debt. And that has been wiped away. So thank you for your leadership, and it's a wonderful day to celebrate this anniversary.
Thank you for being with us. Thank you. Keith, thank you again for having us here. And not only that, more importantly, for what you do. The community-based care is so essential to meeting the needs of people. You'll tell us about it.
Sure, yeah.
Thank you.
Welcome to the party. So what can I say? The Affordable Care Act is awesome. I mean, that sums up pretty much what I have to say about it. I have worked for the city since 1995. I worked clearly before the Affordable Care Act and then after the Affordable Care Act. That tells you how old I am, in case you're counting up on your fingers. But what I will say is what I noticed before is that people would come to care later in their illnesses. They would avoid their screening that could help and their preventative things that could help them along the way. And they would pick and choose what they could and couldn't have when they did get into care based on making sure that their family was taken care of. And that is wrong, right? People shouldn't have to worry about whether or not they can afford anything, right? And it shouldn't affect them and importantly, their families forever. And the ACA came along and is a massive game changer, right? It allows us to have more resources for our patients. It allows them to come and access the care earlier, which is great. And I have a specific story, and one of my patients that I really love came after she got coverage, and we were chatting about different things, and she agreed to go get colon cancer screening. She ended up having colon cancer, but she got it detected at such an early stage that they could do something about it. But what I remember more than the hundreds of stories that are like that is she came back to me and she said, I have a new granddaughter, and my granddaughter now gets to keep her grandmother, right? And that, to me, is probably the most important part of this, because we've changed the trajectory, not only for her, but for her family forever, right? So for me, the Affordable Care Act is a game changer, and it's one of the best things we've had in medicine.
Oh, well, thank you. And so, in the implementation of all of this, as I said earlier, we're very proud of Covered California and how they not only met the needs of Californians, but served as a model to the country. Isabella, thank you. Isabella Koo, thank you for your leadership and for being with us today. We want to hear from you about Covered California.
Thank you very much, Speaker Emerita Pelosi, for inviting me to be part of today's roundtable. Yeah. So I'm an enrollment partner and also a consumer of Covered California. I have been working with the Covered California enrolling consumers since 2014 and have local storefronts located in the heart of Chinatown. I also volunteer my time at the city library to help community residents learn more about their healthcare options. On the 14th anniversary of the signing of the Affordable Care Act, I have witnessed firsthand the impact the Affordable Care Act and Covered California has on the lives of people. The personal impact has been tremendous. In 2022, I lost my employer's sponsor coverage, and I signed up for a plan in Covered California. During that year, I was working very late because open enrollment. And I was signing up the clients into the coverage. I noticed that the restaurant across the street was still open. So I decided to go and grab the dinner. It was a foggy night, okay. As I went toward the restaurant, I was asleep on the cement and fell next to a tree. So I found my shoulder, I was end up breaking my shoulder, and I need to go to the emergency room. So the staff in the hospital were very good. I received quality medical service. So because of Affordable Care Act and Covered California, I was covered. Yeah. I always tell my clients that the health care is an investment in their health. You never think an accident or diagnosis will happen to you. So it's better to have the peace of mind that you are covered, right? There are plenty of times clients called me when they're already sitting inside the emergency room after the open enrollment closed. So because of the Affordable Care Act, I and my clients access to affordable and quality health care. I'm so happy with that. Thank you, Speaker Emerita Pelosi, for working for us for such a great job.
Monica, Isabella has told us professionally about Covered California and personally about her experience. I'm sure you have many stories to tell, but from your perspective, thank you for being with us this morning. We look forward to your comments. Thank you.
Thank you, Speaker Emerita, so much for having us, and I'm so pleased to be here. As mentioned, I'm Dr. Monica Soni, the Chief Medical Officer at Covered California, and also a practicing primary care doctor. In fact, I trained just down the street at San Francisco General Hospital. That was sort of the origin for me, and I absolutely have seen the devastating impacts of not having care, delaying care, because of concerns of coverage or cost. But at Covered California, we have served over 5.5 million people since the passage of the Affordable Care Act. This year, we hit record highs of nearly 1.8 million people covered. And those are Latino, Latinx, Black folks, Asian folks in our communities who now have coverage, right? That is huge, and it is thanks to you. Thank you to you. Thank you also to Congress, to the Biden administration. The Inflation Reduction Act was critical. We now have affordable, high-quality plans. 90% of those folks I just mentioned get some form of financial help. Because of what we have in place right now, we cannot take it back. Folks will lose their coverage. They won't be able to afford it. So I sit here in gratitude because I remember those days when having acne was a pre-existing condition. That happened to me. I couldn't get coverage because I had a pimple one day. I mean, that is what happened to me, right? When being pregnant was a liability. Those were the days that we lived in. Those are not the days anymore. People are getting life-saving therapies. They're getting cancer screening, screening for diabetes, screening for depression, screening for substance use disorder, and the care that they need subsequently because of what we have in place right now. So I absolutely am thrilled to celebrate. Thank you so much, Speaker Emerita Pelosi. Thank you to all of you for being here. Just really sit in gratitude.
So Donald.
Hi.
Hi. Good morning.
Good morning.
Thank you for being with us. Thank you again, as I said, for the generosity of spirit to share your story.
Sure. Yeah, thank you so much. Hi, you guys. And it's Saturday. Glad you guys came down. So my name's Donald Johnston, and I live in this community, and I work in this community, and I'm born and raised in San Francisco, many generations, actually. Irish. I grew up in Visitation Valley, but I live right blocks from here. I'm a patient here. And I want to, if there's any staff here at the hospital, I want to thank you first, because this place has made it so easy and comfortable and wonderful staff. I'm so glad they built this new place. I was down here opening day taking pictures, and that's how important this place is, and I'm glad you're here, Nancy. Yeah. So my story, I was a long-term offender. I went to prison. Did 28 years, and got my act together. I've been sober 24 years.
Donald, could you just put
The more? Yeah.
Thanks.
So when I got out, I was an electrician and an engineer and all that. But just what pulled me? I work in the community. I work in South Market community, Lower Polk, and right here, I help guys on probation when they come out of 850 Bryan Street. I have a lot of certifications in that, and I end up going this way instead of doing electrical and engineering, And Ron Sanders, who works here, invited me down. So I'm going to tell you a story. When I was getting out of prison, they were granting me I'm getting out. I go to the doctor, and they say, "Oh, you got a lump in your chest." I'm getting out of prison, and I'm scared to death. I'm telling my family, "Oh my God, I think I got cancer runs in my family." Oh. So I get out. They signed me up. I didn't really even have to do it. They helped me get care, for me. Well, they ran a test here. Went to the hospital. I love the new Zuckerberg. I remember the old place. Well, I did the test. Guess what? They were wrong. I'm healthy. Okay. So that was my story getting out. But I'm going to tell you, I help people here in the community get on Medi-Cal. And I've done it a few times. And I have friends that I helped also. And it makes it so seamless. And the care here in San Francisco is wonderful. 97% of people didn't know that statistic. That's wonderful. So I do want to say that the Affordable Care Act, it was granted when I was in prison, but I was rooting for it. Go Obamacare, come on. Everybody was rooting, my mom and my aunts were all school teachers here in the city, So I remember when I was younger, I was married, had kids. I was working construction. Not everybody had coverage. I remember having to put my kids on Medi-Cal for a while. We never got food stamps or we never got cash aid, but medical, I was working and I still couldn't get medical for my kids. If I had kids now, they're adults, but if I had kids now, they'd be on medical now. But I remember struggling back then, and I appreciate it. All right, and again, welcome to my community. I live here. Welcome to my medical center. All right. Thank you, Nancy. Yeah.
Well, Donald's story is not just personal, but it's really a testimonial to community health centers. This has always been a big part of our advocacy in Washington for all of us who represent California and San Francisco, because we see what is important about community health centers and the proximity and the comfort level and the appropriateness culturally and in many cases linguistically and the rest of these community health centers. So we always, in any of these healthcare initiatives, promote. I said I would carpet the whole country with community health centers, and we go through periods where we can get more money for bricks and mortar, but not more money for program. Other times more money for program, but no bricks and mortar. So we want to make sure people know that you can't have one without the other. But thank you for the testimony you give to that.
I'm on the street down there, and I see you down on Howard Street, as we've met before, and Rudy does a lot of good work. I work right next door to where Rudy is down there, and he just did the gun buyback. That was cool, and I work in that community. I work in Lower Polk, and I work in this community. And so I'm on the ground, you guys doing it. And it's kind of cool, frustrating sometimes, but it's a struggle that's for the good. Thank you, Nancy.
Thank you, Donald. And Isabella, when you talked about having that accident, you were reminding me of when we were doing the bill, we had the invincibles, the young people who were never going to be sick or never were this or that, but they realized that they needed the protection even though they were young. And who was not, oh, I don't need it, who had a skateboard accident, who didn't, I don't need it, had a cancer diagnosis. No, you know the examples. And they became a big force in all of this, and they continue to be. But we want them to understand that the staying on their parents' plan is at risk if we don't save that. And when you talked about the patient who now her granddaughter has a grandmother, this is such an important, the family experience there. But it also spoke to early detection. Early detection, no free examinations, no copay for certain things, and that is just made a very big difference. I don't know if you want to speak to that piece again, as you did so eloquently in that story.
Yeah, no, I think that's one of the things that's great, right, is that the more that we can screen, the more that we can offer people these tests in advance, the earlier we can actually intervene, because we have interventions that have been proven to be able to work for many of these things, which is why we screen. And one thing I didn't mention earlier, the ability to decrease the disparity in our health has made a huge impact in our community. Offering health care to people who are Black or African American or identify as Latinx, and having them be able to come in and get preventative care, get screenings, get care when they need it has been a game changer, particularly down in this community.
Well, and that was part of the heart of the legislation, is ending the disparities. And I'll come back to that in a moment. But Monica, when you were talking about the IRA, the Inflation Reduction Act, just to remind, it lowers the cost, again, as I said, of insulin from $400, $500, $600 a month for seniors on Medicare. And our goal is to get that for everyone. And President Biden mentioned that actually this morning. And then to have a cap for seniors of $2,000 a year. I mean, it was endless for them, endless, $2,000 a year. And again, this was something that when we won, with your help, the election in civics, again, 2006, we had an initiative, a New Direction for America, 6 And one of those 6 was to enable the Secretary of Health and Human Services to negotiate for lower prescription drug prices. Of course, we passed it in the first 100 hours in the House, but we couldn't get it past the Senate, which I reminded the 2 senators yesterday, President Obama and President Biden, because they were in the Senate at the time, and they said, well, we worked on that in the Senate, in their remarks. And I said, wait a minute, you worked on it after we passed it, and you didn't pass it, because Pharma they had that 60-vote thing that we have to change, but that's, again, another subject. But the IRA is something that Pharma and the insurance, and all of them, big money interest, and of course, because it saves the planet, was the biggest investment in climate initiatives ever. You add in the fossil fuel industry with Pharma and all of that, and you've got a big force against us there. But we were able to pass it, just historically speaking, without one Republican vote. So they're mobilized on the other side, as is their candidate for president, and these forces of big dark money in politics to try to reverse that. Isn't it shameful that they would try to reverse that, but so much it means? And you spoke beautifully about community health centers, Dr. Colfax, earlier, but it is key to what we talked about the diversity issue. And that was really important. And our President Obama, had this as a priority, as we did. Of course, in the House, we're 70% women, people of color, LGBTQ. So that's who we are. That's who we represent, and that's what we want to see in our legislation. We didn't have that many then, but we do now, and we're able to pass these bills in the last Congress. So there's a great deal at risk, but there are more improvements that we want to make. We've got to get Medicaid. The Supreme Court ruled against us on Medicaid. My personal favorite, the Supreme Court. They ruled against us on Medicaid because it was in the bill that it would every state would expand, but it was language that was in the Senate bill that got us in bad shape there. Our House bill would have. You see a thing here. Anyway, I thought maybe we could have some questions from the audience or from the press on any of this for our special guest here. Does anybody have a question? Yes, Susan. Susan Pfeiffer is just the queen of the texting, calling, and all the rest, and she tells us what language we should be using that really works.
Thank you. As usual, this has been uplifting, informative, and a wonderful event. Here's my question. If the Democrats win a decisive victory in November, re-electing Joe Biden as president and holding a strong majority in the House and Senate, what would be the first legislation you would like to see passed to improve the Affordable Care Act and get that enacted?
Okay, thank you. Yes, and I always like to say President Biden and Vice President Kamala Harris, as well as what we have to do, though, is not only win the Senate, but win it in win it in a way that enables us to get rid of the filibuster, because that's why we couldn't pass this in 2007, the first day we were in, and we put this on the table, the prescription drug thing, but they have a 60-vote requirement. It's something that should be, well, I said I'm going to send you a box of 100 powdered wigs to go along with your policy over there. But the thing is that if we can get 51 or even 50 plus the vice president to do away with the filibuster, then what we would really, it addresses the diversity issue, it addresses income issues and the rest. We would have to pass something that would pass muster in the Supreme Court to expand Medicaid. That affects the most people in the most diverse way and economically as well. That would be something we do. We would continue, we have to, some things expire, we have to make sure that our subsidies, to the extent that we can even improve that to enable more people because one of the things we didn't like about what was in the bill, we wanted the threshold to be higher. And then we were able to do that in the rescue package and then in the Inflation Reduction Act, not to get too technical about the legislation, but all these things. Now, when we talk about health care, we're talking about also other aspects of it. We're talking about family and medical leave. Mm-hmm. We're talking about home health care workers. We had $400 billion on the House side for home health care workers. Of course, it didn't survive the Senate, but nonetheless, we know that has to be done. And so, again, some things that relate to home health care relate to women in the workplace and men in the workplace who may have a sibling, a parent, in addition to a child, so that they can be present at work, not worrying. And not only to know that those people are taken care of, but that we take care of the caregivers with respect, with training, and with... And in my view, we don't agonize, we organize, we unionize. We want them to be unionized as well so that they have their standing. I remember, we've been doing this for years on the home health care thing. And one of our witnesses who would come from time to time, she would stand up there and she'd say, I do this for this family and that family. And then they're complaining about the cost and this or that. And I say, you don't think I'm worth it? Do you think your mother's worth it? But that's what it's about. It's about family, and it's about freedom and liberty for people to work. So we have, of course, I always had wanted a public option. Broke my heart that we didn't get it. We had it in one bill in the Senate, but not in the other, and we had it in the House, but it didn't prevail. But I think we put things in the bill that accommodate that, enable a state, and Covered California comes as close to that as possible. So again, we'll always look to see and listen in terms of implementation, not just in our community health centers and our public health authorities and the rest, but from the people as to what improvements that we can make. And we have any number of things from a technical standpoint to do to facilitate. But again, we're looking at healthcare beyond the bill, but in terms of home health care, family medical leave, and all that goes with it. Do you have any suggestions? Let me just go to one other place. One of the important things about this bill that it's not unspoken, but I want to reemphasize, are people with disabilities or people with different abilities are very well served by this and very well served by Medicaid. And some of them are veterans. And they say to me, we don't just want to be taken care of in the VA. We need Medicaid, we need food, we need housing, we need all these other things too. And we need mental health care. We passed the first bill about parity in the Congress, parity in terms of that. And the Republican, no, I'm just telling you, the Republican who was the co-sponsor of the bill said we could never get a hearing on this subject, mental health parity, until the Democratic majority in 2007. So 2006 we won, 2007 we took office. So we want to have more clarity about not having any difference between health, mental health. It's all the same thing. Do you want to speak to that, Dr. Colfax, about what we could be doing better and more, in terms of funding as well?
Yeah, well, I appreciate that. And I think with regard to behavioral health, the ACA was a game changer, right? So as you pointed out, the parity pieces really came into place. I think realizing on the ground that parity is still a journey that we need to commit to and make the investments in. I think that there are key areas we know, for instance, and you talked about beyond the direct, the care policy. What about workforce? Right, and I think we know that, especially with the behavioral health issues that we have across the country, and including locally, how do we invest and expand a workforce that's needed to address the issues, whether it's mental health issues, whether it's substance use disorders. It's a key thing, and thanks to your leadership and the work that we're doing, we are hiring, we are expanding locally. But as I talk to our team, and I talk to health directors across the state and across the country, the investment in making sure you may have coverage and you may be able to theoretically access a behavioral health provider, but I think many of us, I've had the experience where that behavioral health provider doesn't exist. So I think really thinking about how do we continue to expand and invest in workforce issues is really key, and then we will realize the parity that your leadership has continued to move us forward on.
May I add one piece
Please,
to that?
Mark,
Yeah, it's been really fascinating at Covered California. We were looking at in 2022 how many folks received behavioral health visits virtually. That number was over 75%, right? So to your point, I think there's creativity happening in the workforce space about how do we actually meet needs, how do we deliver on the care folks need, both from a mental health, behavioral health perspective and physical health. And I've been wowed, to be honest, at Covered California with it's true, we need more people doing the care, but we're still finding ways to deliver that high quality care, particularly in the behavioral health space.
Thank you. Keith, did you want to say anything about that? No? Oh, we can go on to the next.
No, I mean, I think that we're trying to integrate more and more behavioral health here in our clinic. We have behavioral health clinicians here, and what's amazing to me is how many of our patients need access to behavioral health immediately. And on any given day, you know, if I see 10 patients, maybe 8 of them really need somebody to come into the room immediately and offer them services on the spot in a compassionate, trauma-informed way. And I think we're lucky to have that right now. I think it needs to be expanded even more than it is currently in the city and across the country.
God bless you for that, to treat them with that respect. We always say when it comes to people with challenges, whether it's other disabilities or the situation you described, we don't judge people for what they cannot do. We respect them for what they can do. And this, a lot of our, just in terms of workforce development, because in everything we do, when we do infrastructure, we do this, do that, it's always, what are we doing about workforce development? Now we're talking about the human infrastructure, workforce development. And if, what I was told, because we spend a good deal of time looking at our veteran situation, challenges, if everybody who is in education now, education system for any behavioral training, every one of them were applied to the veterans' needs, it would still not be enough. And then we have other needs beyond that. One other health issue we passed, but I'm very proud of, is called the PACT Act. And the PACT Act addressed the burn pits, that if you were exposed to burn pit, it's carcinogenic in many cases. But we were making people have to prove and document and this and this and this. So our bill, the PACT Act, just said, you were there, you're diagnosed, you're in. Yep. And hundreds of thousands of veterans have already, since we passed it 2 years ago, have already had benefits from it. A couple million have signed up for it, and hundreds of thousands of people who are veterans who never availed themselves of the benefits of the Veterans Administration signed up. And what I mentioned that is outreach. Again, Grant, you kind of alluded to this in terms of people have to know, they have to know that this is available to them, or that they can come forward early. And what that is. So outreach was, and that addresses our minority community, because many communities were not in the loop sufficiently. And so we want to make sure that they know, and that's part of what we were doing with the presidents this morning, is to make sure many more people know what is there for them if they would sign up. But it is, with the PACT Act, some of these burn pits, okay, is it got a burn pit? 3 football stadiums long, burning terrible things. I won't even go into it because it's morning here. Terrible things burning and carcinogenic. But anyway, I say it because a lot of it has come to many behavioral situations, A, and B, outreach and the rest. I don't know if any of you, Isabel, if you wanted to speak to that.
So
Donald?
two bullet points. I know that I work next door, right next to Swords and Plowshares. I know you're familiar with their, our company I work for is right next door. So I see the veterans come in.
I had the head come as my guest to State of the Union address.
I was there when you came down.
Michael Blecker.
I was there when you came down, and that's very important to reach out to the veterans right there. And I know that a dual diagnosed mental illness and addiction problems come within the military quite a bit. And the guys come out and they have coffee. So when we're going in and out of work, we talk to the veterans down there. We do a lot of outreach down in the South of Market, thank God. One nice thing, too, that I know it has to be mentioned, that I know the California covered in the Affordable Care Act here in California, we're respecting women's rights. And women's rights are under attack right now in the United States. So I know that we're a shining beacon for women's rights here, and that's very cool, you know. I advise all you guys to vote, you know what I mean? Because women's rights are under attack right now, they really are. Look at the other states, and so we want you in there fighting for that too, Nancy, you know what I mean? Yeah.
Now, thank you, Donald, because of that, women's reproductive health issues are health issues at America's kitchen tables, and of course, it's not only at risk, it's they would do away with it. And one of the things that we had in the budget that passed early this morning in the Senate, but we passed earlier in the day yesterday, was to retain the ability of women in the military to have access to what their reproductive needs were. There were certain things we didn't like about the bill, but that was a real victory because you can just imagine what the other side thought about that. And if you listen to the debate on I have to say this is just a technical thing, but we're having the debate on the floor yesterday morning on the thing. And of course it's, again, when it's a compromise, you're like, this isn't what I would have written, but again, we didn't even have the majority, so and what the Republicans did do was limit the amount of time that those who would go to this point and say, this is, this promotes abortion, this does this and that, because it wasn't constructive. But to their credit, they just stuck to other points in opposition to the bill, but we still were able to pass it. We had 101, or was it 101 or 2, Christine, Republicans, and the Democrats had, 185. We had to save the day, but we had to get the job done for the American people. But that issue, not just in terms of women writ large, but women in the military as well, was a victory in that legislation. Any other questions? You have a question? Thank you.
Hi, yes, I'm Carolyn Chu, a family physician with UCSF, but I work up at one of the community health centers at the General. So how has copay-free access to preventative health services improved the health of your patients? And have the annual wellness visits improved the provider-patient relationship? Could you speak to a little bit to that?
Well, I think, Grant, you really can speak to that so clearly. It has made all the difference in the world, and Monica, you as well.
Yeah, I mean, I think from the local health delivery system perspective, the zeroing out of copay requirements for many things has been tremendous, right? And even, in systems where that copay may not have existed before, just the perception, because we've talked to patients all the time that, we're too fearful to even come through the door of a healthcare system because they had had firsthand experience or family experience with, you walk in and you walk out and then you feel better, but I don't know, 6 weeks later you get a massive bill, right? So I think there's both the practicalities of how much more affordable the care has been, and even more importantly, the perception that access is available for everybody because of this change in the co-payment structure. I mean, it's unbelievable that 14 years, how far we've come in 14 years. I mean, medical debt and the affordability of healthcare has just been transformed because of this. And I think it's important that we remember that, and that's why I'm so happy we're here today. And from your perspective, I'm sure you have more to share.
No, agree. And I think the other thing that's happened, as you know, of course, as a doc, is the guidelines have changed, right? The screening recommendations for breast cancer screening for mammogram went down to what I will call a younger age. It's 40 now. And for colorectal cancer screening, it's 45. So those invincibles walking around, right, actually at a minimum, you need to be getting your cancer screenings at that young age. And so I do think super transformative to be able to have those services be free, to know that you can get those recommendations for free. For me as a doc, it means a lot to be able to say, just walk in the door. Let me check all these things for you. You're going to walk out with no cost for that, and at least peace of mind. I mean, that's a lot of what we say at Covered California, is just have the peace of mind of getting those things checked.
And And also having the education that goes along with our annual screenings. I think being able to come in and get bias-free information from your provider on the spot to make improvements or change your life is invaluable.
Isabella, did you want to say something about this? You okay?
Yeah, I'm good.
You could, the two of you representing covered California. Well, again, while you're speaking, I'm thinking of HIV and AIDS, and I see Dan Bernal here, and this was such a big thing, right? No copay, because people are afraid to go because of what it's going to cost or what you're going to find out, and then how much is that going to cost, and the rest. Dan is now, he worked with us, 13 years? 22. Seemed like 13 to me. It seemed like 22 to him. But now he is Vice Chancellor at UCSF starting the end of last year. We're very proud of Dan and his work there. And he has lived with HIV/AIDS for how many years?
34 years.
34 years.
Yeah.
And that's really a tribute to the healthcare system as that, because we really were the intellectual resource for community-based care, community-based prevention, community-based research, and that was the essence of the Ryan White Care Act, that precious boy. And that has been a lifesaver too. But again, free copay, that makes a tremendous difference. Any press question? Any question for the press? No? You good? We'll talk later. Yes, ma'am.
Thank you for throwing this party on this momentous anniversary. Speaker Emerita. My name is Lori Bremner. I'm a volunteer with the American Cancer Society Cancer Action Network. And as a self-employed cancer survivor, one of the happiest days of my life was clicking the submit button at Covered California in 2014 and purchasing health care as an individual for the very first time.
Yes.
But my question is this. Since we know that access to affordable care can determine whether someone with a cancer diagnosis lives or dies, will you support legislation to make permanent the expanded tax credits that ensure Affordable Care Act plans are affordable at the marketplace?
Yeah, absolutely. That is our goal. That has always been our goal, and we keep pushing, renewing, but yes, that would be very important. And it's something that members of Congress have to hear from their constituents. I mean, it's not an issue on the Democratic side. They'll just say, well, it costs money. Really? Well, how about getting sick? Does that cost even more money than having the tax credit? And I'll just say this, and then we'll have our birthday cake, okay? I'm not sure it's chocolate, though, but anyway. The thing is this. One of the fights that we have on all of these is the battle of the budget. The budget should be a statement of our national values. It is our statement of how we allocate our resources. I myself am a pay-as-you-go person, which means what we do, we should either pay for or offset so that we don't add to the national debt. The other side says, oh yes, I think that applies when we're feeding people or providing health care, but not when we're providing tax breaks for the wealthiest people in America. That should not be covered. So in their last bill, they did, when what's his name was there, they did it, and it's up for renewal. They're going to try to do it again. God forbid. Then it gives 83% of the benefits to the top 1% of people in our country. 83% of benefits, adding $2 trillion to the national debt because we shouldn't offset tax breaks for the rich. But if you want to feed the children, you better pay for it or find an offset. So one of the fights going into this week, this vote yesterday, Rosa DeLauro, who's like an angel from heaven, whether it's tax credit, health tax credits, child tax credits, food, feed the children, whatever it is, she got $1 billion for feeding and for the WIC and all of that. But it was a big fight because they were saying this is going to add to the national debt. $1 billion while they added $2 trillion to the national debt. So understand when we're having our fights, it's about values. It's about how you allocate resources and how you understand the kitchen table of America's working families. I don't have to tell any of you about food banks and how much people depended on them and continue to depend on them, but that's all funded. Much of it is funded on the public side by the federal budget. And do you believe that was one of the points that was holding us up? They didn't want to feed women, infants, and children. But Rosa got it done because she's Rosa, and she just wouldn't go away, and she had us all, shall we say, surrounding, so that everybody knew that issue wouldn't go away. But that's... And so that tax credit, that's so easy, right? I mean, that's so logical. It makes so much sense. It makes such a difference. And if people have that, they're avoiding perhaps getting sick, which is going to cost so much more. So it's a false economy. It's a false economy. But again, we could go into a lot of the fights that we have on a day-to-day basis there. But again, know your power. Your makes all the difference. The questions you ask, the challenge, and share with others in your organizations and the rest, as you heard here, hearing the stories, is the most eloquent part of it for other people to hear. For other people to hear, so they know what is at stake. And we started with the young people understanding they're off. Why would a political party want to take kids off their parents' plan? Except they don't want the parents to have a plan, because that's not in the interest of profits. Greed, our old friend greed of the insurance industry and the pharmaceutical industry. And I know these people, I talk to them, but I try to be, I can't say respectful, but listen, but it's about money. It just comes down to that. And we want to save money, we want to reduce costs, we want to improve health care, we want to give people confidence that they can come in with no copay, that we have a tax code that addresses, that facilitates so much of this. So it's about the Affordable Care Act. I'll just close with this inspirational message. What's his name said, Obamacare sucks. Is that inspiring you at all? And we say, no, it doesn't suck. It cures. It cures. And so that's what the fight is. That is what the fight is now. That's why we want to celebrate what it is, improve what it can be, and we can't do it without the mobilization of people who know and who care and see the difference. So thank you for being here to share the birthday of this 14 years, which has made a difference in so many people's lives. Yeah. Do you have any last words you'd like to say, Donald?
You inspired me. I was going to say you and everybody, the Affordable Care Act, my sister lives in San Bruno here. My eldest sister, she's 72. She's been fighting cancer for 1.5 to 2 years. It's not one of those that takes you quick. It's one of the long ones. She's on it. She's on the Affordable Care Act. She doesn't even get a bill. She goes to the hospital, some of the most expensive medicines and treatments. Not one bill comes, and my brother-in-law actually gets paid to help take care of her. She's pretty much bedridden right now, is now in the hospital. Not one bill comes to the house, and she's getting top-notch care. Double, it's spread, bad. So, can you imagine them being bankrupt at the same time, So, it's worked. It's working, for real.
Thank you, Donald.
Yeah, I have a client. His father was 70 years old, a newcomer, from mainland China. So after he's holding the green card, and then I enrolled him into Cover California, the healthcare plan. But 2 months later, he had heart disease surgery. You know, the cost is really high. And after the surgery in the hospital, he has no infection, he can sing and dance. And then both of he and his father sent me a gift card and say thank you to me. But I should say thank you to you.
Keith, you'll have the last word because
I
we're
get the
here.
last No,
We
no.
have two more here before you get the last word.
Oh,
The last.
No, I'll just say that, one of the things is we know California is expensive. And some of what we benefited from with the Inflation Reduction Act is that, households of 4 that we would, are still actually struggling to make ends meet now are able to get coverage through Covered California, and they weren't really before the Inflation Reduction Act. We saw hundreds of thousands of families get coverage after that change, and we're really afraid. The conversations for us inside are what will happen if we don't get those extensions and if things change in the administration. So, I'm excited, happy 14th anniversary, but I do hold a little bit of fear inside right now.
Thank you, Monica. Go ahead.
Well, I just think on behalf of the healthcare systems of San Francisco, that the Affordable Care Act has truly realized the goal of making every door the right door for healthcare, and want to thank you for your leadership on this anniversary.
Thank you. Well, I want to thank all of you, but as I yield to Keith, just say, we're very blessed in San Francisco because we have such a dedicated team of people who care about healthcare administratively, providing care and knowing about policy and the rest, and patients who will speak up. And one other resource that we have is University of California, San Francisco, and San Francisco General, and as you said, Laguna Honda, and San Francisco, University of California, San Francisco is the highest recipient of federal grants of any public institution in the country. And we always make sure that happens. But apart from our advocacy in Congress, it's because of the quality of their the national significance of what they do. And so we're very blessed with that. And again, getting back to AIDS starting a long time ago, but even before that and since then, as I mentioned, Dan is now a vice chancellor, and so we're very proud of that. But take back our thanks and appreciation to UCSF because it's been a tremendous intellectual resource, also from the standpoint of being an example of how you can provide care in a way that is value, not volume. And this was a big fight on the Affordable Care because some places would take care of people, sort of send them home. They'd have readmission after readmission after readmission, which wasn't good for the patient, and it wasn't good for the taxpayer who was ultimately paying some of whoever was paying for that health care. So again, a big example of value, not volume, and how to make sure as they cared for people and sent them home, there was a good chance, unless something unforeseen happened, that they would not have to come back. So that was the biggest fight in passing the Affordable Care Act, the big regional disparity. Because some of us were saying, why should, and then those people in those regions that were getting big reimbursement for low performance were costing money, and they said, well, we'll vote for the bill if you grandfather us in. I said, well, there's no point in grandfathering you in, no use doing the bill, because you're going to cost us more money. And what was more important, it was poor performance for the patient. That's right. For the patient. So anyway, you probably didn't know that you were going to get caught in the intricacies of how we passed the bill. But one of the examples, and we had as witnesses and testimonials from UCSF about all of that, and San Francisco General being such a model. I'm always grateful to San Francisco General for saving my husband's life. But thank you. And now, before we sing happy birthday and see if it's chocolate underneath it, we're going to yield with gratitude to Keith for his hospitality, for his leadership, for the care he gives, and the example he sets. Thank you, Keith.
Oh, thank you. I mean, what I would say is thank you very much, and thank you for being here. That's great. Happy birthday, Affordable Care Act. 14 years. This is great. I mean, it's changed the lives of patients. It's changed the lives of families. It's changed the lives of communities. And it's changed the lives of staff who work with people. It's an amazing thing that has happened. We've done a lot. We've come a long way. We still have a way to go. But I think it's time to celebrate. Happy birthday.
Okay, who has a voice? Who has a voice? Anybody's going to lead us in happy birthday? Oh, that version, okay. Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday to you.
These are my boys.
Precious. That was her name?
This is Campbell, and that's
Hi,
Ashton.
Campbell.
Ashton, yeah.
Ashton, beautiful. You should probably have the first pieces of this cake. Come on, guys. Let's
Yeah.
get our picture around the table.
Now it doesn't make much sense. There ought to be a law against anyone who takes offense at a day in your celebration. 'Cause we all know in our minds that there ought to be a time that we can set aside to show just how much we love you, and I'm sure you would agree. What could fit more perfectly than to have a world party on the day you came to be? Happy birthday to you. Happy birthday to you. Happy birthday. Happy birthday to you. Happy birthday to you. Happy birthday. I just never understood how a man who died for good could not have a David Wood. He said, aside for his recognition, because it should never be just because some cannot see the dream is